Hello, welcome. My name is Hannah and I'm a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead as well. And I provide one-to-one private tutoring for OSCE international nurses in their OSCE exam, and also for UK student nurses with your BSc and MSc academic work as well. If you're new to my channel, I try and share lots of helpful information for those that are self-studying for their OSCE. Because it's a very expensive exam, and if you're starting off by yourself, it can feel a little bit overwhelming in what you need to do. So welcome, please like, subscribe and share. Had some brilliant successes, so thank you to all of those that are sharing your successes of passing your OSCE first time through self-study and using my videos, which is absolutely brilliant. So I've had quite a few requests to do like an evaluation demonstration, so I'm going to do that today. But first off, I'm going to go through and look at the marking criteria actually and annotate the marking criteria, because the evaluation station is actually quite easy because you've got all your information, all your papers, so it's just knowing where to go and find that information. Okay, so I'm going to use the ectopic pregnancy as an example. So remember, your evaluation station is the last station of your APIE. So it's where you are going to be handing over your patient. And so you've got 8 minutes to plan and verbally hand over your patient to the examiner. And really the underlying aim for this, and something that's always really important to remember, is you've got to ensure patient safety, okay? And you need to ensure the information you're handing over is going to allow continuity of care for that patient. So if you were never to come back on shift and look after that patient again, are you handing over all the important things to that nurse so they can carry on giving the same standard and quality of care and that patient remains safe? So you will have all your paperwork from your previous stations. So you need to use it. Okay, that's why you've got it. And so actually, it's actually quite easy, because the bottom line is you need to pick up the paperwork from those 3 stations and read it. And you're basically handing over to the examiner what you've done in those 3 APIE stations. And then the final part of the evaluation is you then need to think a little bit in your own head about what are your further recommendations to the patient. So what do you want the person doing to carry on for them? So I'm going to, like I said, I'm going to go and annotate the marking criteria now. And it's quite a good thing to do whilst you're studying as well, to annotate your marking criteria, so you know exactly where you need to go in terms of your papers to get your information. So firstly, with marking criteria, just making sure you're using the most up-to-date version, and make sure you're regularly going on the NMC website and checking that, because they do change and update the marking criteria without putting out a formal announcement. So your evaluation is structured around SBAR. So I've got a more detailed evaluation video. If you haven't watched that, I recommend watching that first. But we're going to do situation, background, assessment and recommendations. So the situation is very simple. You're going to explain yourself in your clinical setting, patient's name, date of birth and hospital number, and your reasons for handing over. So all this information you'll kind of know already. So you'll know who you are, you'll know your clinical setting. This will be on your evaluation briefing, okay? So we'll have a look at that before I do the demonstration. So that is going to tell you where you're currently working, because remember, your patient journey can change through your APIE. So, you might have started off in the emergency department, but by the time you're coming to evaluation, they could be on the ward, for example, waiting to go home. The patient details, you'll know those, and they will be on the top of all your paperwork normally. So just find those, and you'll just need to be able to read those out. And your reason for handing over, again, this should be on your evaluation paperwork, evaluation briefing. And we'll look at that and how we do that. And then you're going to go into your background, okay? So background is taking us back to our assessment station. So this is why you've got your assessment station information. So you need to hand over the date of admission, the reason for the admission or the visit if it's in a community setting, referral to any specialist teams and diagnosis. So this will all be on that assessment briefing that you get in your assessment station, and I'm going to show you what that looks like. You then need to do medical history, relevant medication and social history. Again, this is all on that front sheet of that assessment briefing. Okay, so if you pick up that assessment briefing and read it, you're going to hit all these criteria without having to memorize anything, without having to really think, and without having to rewrite everything onto your SBAR planning template as well. So it's all going to be there for you. So just want to read that out, okay? Then this bit sometimes causes a little bit of confusion. So details of current events and details from an assessment station. So this is your observations and information from your assessment station, okay? Which is why you'll have your news too. So you want to be handing over all your observations that you've heard and any key information from your holistic assessment, okay? So this is, I can't spell today. I can't spell most days, but I'm definitely can't spell today. So from your holistic assessment, okay? Which is why you've got access to your assessment paperwork. Then we're going into the assessment part of the SBAR, okay? So here it will say for most recent observations and then any results from assessments taken and what changes have occurred. This is where you're going to go back to your valuation briefing because you'll have a new set of observations and compare these to your assessment station observations, okay? Now we're on to main nursing needs, okay? So this is our planning paperwork. So we're going to summarise our 2 main care plans. So again, what were our 2 problems? And just a few, 2 to 3 key interventions of your care plans, okay? And make sure they're specific to your problem, yeah? So you don't read those generic ones like going to document the care and make sure they've got the call bell. What are the specific ones related to, the issue of pain? So we're going to do the PQRST assessment, for example. We're going to give, analgesic as prescribed. We've supported with repositioning, okay? Nursing and medical interventions complete. So you'll cover some of this in your care plans already in above, okay? So key interventions that you've done is already covered. If you've read through your care plans, but if you haven't, make sure you do this here. And then really importantly, we need to get our implementation paperwork and we're going to hand over the medications we gave in the station, okay, the time and any medications we have admitted and why in our intervention, okay. Also, if we've made any referrals to someone in our care plans, maybe refer to physio, refer to dietitian, their interventions that have been completed as well, so we need to do that. Areas of concern, so we just need to pick this up from the information. So if we've got a new area of concern from the information that we've been given in the evaluation station, or we might not have any areas of concern, but we might want them just to continue with post-operative monitoring or continue with pain management, for example. And then our plan of action. So you can prepare some recommendations in advance. Just thinking about, a lot of the time you're handing over nurse to nurse. So just thinking about those key things that you want that oncoming nurse to continue to do for that patient. So, standard things that we'd always want everyone to continue to do is our News 2 monitoring or GCS if it is the subdural hematoma patient. Just put as per policy, and that covers all eventualities. We want them maybe to continue to assess pain, continue to monitor fluid input and output. There might be specific things, there may be assessing the wound. And again, very much depends on your scenario. If we've made any referrals, we want that ongoing nurse to follow up on referrals. So if we've made a physio, dietitian, for example, these are just some examples. So you can put down quite a substantial list of things that you can pre-learn before your OSCE, like standard things you'd hand over to your nurse to continue ongoing management of that patient. Remember things specifically in end-of-life scenario, like the do not attempt resuscitation is important to hand over, again thinking about safety, any social issues and safety issues within the home as well. So that's what I talk about annotating and marking criteria, but also seeing actually where all your information is already present and you've already got it in your papers. So actually the evaluation is a is really just picking up these papers and reading them in a systematic order, and then just thinking about your own recommendations for that patient as well. I'm going to go on now and look at an example here. I'm going to briefly talk through it, like where that information is, and then I'll just do a quick run through for you. So in your evaluation station, again, you'll get your patient information. Again, you might and then you'll get that kind of current update of that patient. So here we've got Maisie, she's 26, and she's now, she came in and was diagnosed with an ectopic pregnancy. She's now 6 hours post-op, and she's had the removal of her left fallopian tube, and it's ended the shift on the surgical ward, and we're handing over to the next nurse on shift. Okay, so I've got a new set of observations. So in part of your planning for evaluation, you want to just look through these observations and pick out if there's anything very concerning. Because if you've got a patient that's deteriorating in your evaluation, your SBAR, you'll need to make sure you clearly get that across in the beginning, and you clearly in your recommendations, you're asking for someone to come and review them straight away. So just remember your normal parameters for observations. Is there anything here which is really concerning? But with Maisie here, there's nothing here. These observations look normal. Blood pressure is a little bit low, most probably normal for her in that age anyway. Temperature's normal. New score is low, and pain score, is a little bit moderate. So we definitely want to focus on that. Okay, so go through your observations, and I'm just going to whiz back up through all the paperwork and show you what I meant by this. So I talked about that assessment. Okay, so all your information is here. Okay, so presenting complaint, past medical history, social history, relevant medications is the drug history, and don't forget to hand over the allergies, otherwise that is a critical fail. So I just need to pick that up and read all the way through that. Okay, I'm then going to have my observations, and this is why it is really beneficial to write down in your assessment station your observations here, because it will be easier to read these off in your evaluation than going back to your news chart potentially, because you might just find that a little bit more difficult to interpret with the timer going on. So I'm just going to write some observations down here, which I would have got in my assessment station, for example. And again, you just need to, you don't have time to hand everything over. I'm just going to do a blood glucose and a temperature. And let's have a pain score. 7. Okay. So that is why it's really beneficial. And I always say to my students to write your obs down here, because it does benefit you when you get to your SBAR at the end. So that will be all our assessment. I'm going to compare those observations again. So I'm going to go back to my evaluation. Okay. And when I'm doing that compare and contrast and comparing them against these ones here, and then I'm going to go to my care plans. I'm going to have my 2 care plans for this patient. Again, that could be pain, could be risk of bleeding, could be post-op wound infection, could be managing anxiety as well. So whatever your 2 problems and care plans have been, then we're going to go to the medication chart. I'm going to read off all the medications that I have given in my station time, and any I've admitted and why. And then I'm going to think about my recommendations. Okay, so I'm going to start the 8-minute clock. I'm going to just talk you through what I would do in planning in those couple of minutes. Definitely don't spend longer than 3 to 3.5 minutes on your planning. Maybe 4 at maximum, but you definitely want to make sure you've got enough time to hand everything over correctly. Because all the information is on your papers, you don't need to spend a lot of time rewriting that onto your SBAR planning form that you get. But if you want to do that, it's absolutely fine. But just practice it and see how it impacts on your time management. When I do the prepping, I'll just be going through the papers and picking out key information and writing key bits of information down just to prompt me. I've got my paper here, and I'm just going to start the clock now. Okay, so I'm just going to read my brief. So I've got Maisie Sutherland with an ectopic pregnancy. She's now 6 hours following her removal of left fallopian tube, and I'm handing over to the nurse on shift. Like I said, I'm going to scan through those observations, make sure there isn't anything really concerning, and I'm not handing over kind of an emergency or deteriorating situation, which I'm not. So I'm just going to go back up and refresh myself on the assessment information. So yeah, so she came in today at 8 o'clock and she had the pain and PV blood loss, nil past medical history, just the fertility treatment, social history, which is there, so smoking, maybe hand that over. Drug history, just folic acid, penicillin, allergies. So I need to make sure I hand that over. So I'm just going to make myself a note on that. I'm going to jot down my observations, so it's just easier to read off due to the time. So I've got a respiratory rate of 24, sats for 96, heart rate 90, blood pressure 90/60, patient was alert, got blood glucose of 5, temperature 37, pain score of 7 out of 10. I'll put that down. Key bits of my holistic assessment I want to hand over is obviously kind of emotional well-being, and they had fertility treatment as well. Again, you can use your news score as well if you want to, that's absolutely fine. My 2 care plans, so I'll just refresh myself on my care plan. So for here I had pain and I had anxiety for this patient. And again, I'm just going to refresh myself on my medications. So I gave clindamycin for this patient, paracetamol, and ferrous fumarate. I'm just checking those, yeah, so clindamycin 12. Ferrous fumarate, perfect. And I'm just going to make some quick notes on things I'm going to hand over. So we're 6 hours post-op, so I'm thinking about news, pain assessment, monitoring for fluid input and output, and bleeding, wound assessments. I've just made some notes there. I'm going to go now and start my handover, okay? Yeah, so hello, my name's Hannah Ames and I'm the nurse working on the surgical ward, and I'm handing over Maisie Sutherland, date of birth 5th of the 4th, 1997, hospital number 126980. She's also on the surgical ward with me today. I'm then handing over to you because it's the end of the shift and she's 6 hours post-op. Theatre, following removal of a left fallopian tube, so I'm handing over her continuing ongoing post-operative care and nursing care. So it's going to go back up to my assessment information here. So Maisie was admitted today. She came in to the emergency department with left-sided abdominal pain and PV bleeding. She was diagnosed with an ectopic pregnancy. The baby was conceived through fertility treatment, and she was really emotionally anxious and upset. She's got no past medical history, just that this baby was through fertility treatment. Social history-wise, so she lives with her female partner who works full-time. She does smoke 10 cigarettes a day, and we did talk about reducing that and supporting her with smoking cessation once they were over this initial loss. She did stop drinking when she became pregnant. She's normally fit and well. Drug history, no regular medication. She was just on folic acid since pregnancy, and she is allergic to penicillin. So on my assessment, she was alert and awake. She had a respiratory rate of 24, which was a little bit raised, most probably secondary to pain, which she had in her shoulder tip and her left abdominal area. Her sats were 96%. Her heart rate was 90 and her blood pressure was 90/60. She had some vaginal blood loss and was feeling dizzy. She was alert though, with a blood glucose of 5. She did have quite a severe pain score of 7 on initial assessment and a normal temperature of 37 degrees. Her main issues from her primary assessment were obviously pain, quite a significant amount of vaginal blood loss, and she was also very emotionally upset and distressed as well. like I said, she's been to theatre, she's had removal of her fallopian tube. She's now 6 hours post-operative. So now her current observations, she is stable. She has going to go back to my observations here. Respiratory rate is now down and is 18 from 24. Oxygen saturations remain the same at 96%. Heart rate is 75, so it has come down slightly from 90. Blood pressure has increased a bit to 105/60. Temperature is the same at 37.4. Her news score is now 1. Pain score has reduced and it is 4 out of 10. So her main nursing needs have been management of pain, of which we've done regular pain assessment using Universal Pain Assessment Score and PQRST every 30 minutes. We've administered paracetamol, analgesics as prescribed, and we supported Maisie with comfortable positions and distraction techniques. Her other main issue has obviously been significant emotional distress due to loss of the baby. So I've just ensured that her partner has been informed and stays with her as much as possible. I have supported her with referral back to fertility treatment and to baby loss support groups as well, and just provided opportunity for Maisie to discuss her concerns with me. The main other interventions that have been completed, so referred her to smoking cessation, also given medications at 12 o'clock. She's had paracetamol of at 12 o'clock of 1 gram, ferrous fumarate 210 milligrams at 12 o'clock as well, and clindamycin antibiotic at 12 o'clock as well. She has got some regular, some as required cyclizine, but she's not needed that, and at 12 o'clock she wasn't feeling sick either. My main areas of concern are just continuing post-operative monitoring for Maisie for any complications such as bleeding and risk of infection, and continuing with that psychological and emotional support. What I'd like you to do is continue with our post-operative care, so news to monitoring as per policy, and continue to assess pain every 30 minutes and give analgesics as prescribed. Follow up with the smoking cessation support when Maisie feels ready. Continue with emotional support as well and allow her partner to be present. Promote mobilisation when her pain is able to tolerate. Monitor input and fluid output. Reassess her wound every 24 hours and just check for any signs of infection, and prepare Maisie ready for discharge. If there's any other questions, then please let me know. Okay, so that's kind of what an SBAR needs to look like, okay, and that's how you can use all your papers to support you with that as well. It does take practice because 8 minutes isn't very long, so it's definitely, like with all your stations, something to practice at a time, okay, and you can make up various different scenarios as well if you haven't got the paperwork. You know, a lot of them are that nurse handovers, so just think about those key things. Remember, it doesn't have to be perfect, but it needs to be safe. You need to flow in that really logical order, okay? It needs to be systematic, and it needs to make sense, okay? If you're jumping all over the place, it's quite difficult to follow for the examiners. So you want to make it as clear and systematic as you can. So my top tips, obviously, in your prep time, order your paperwork and read through it, okay? Make notes if you need to, it's absolutely fine, make your notes. Use your planning time to focus and plan on those recommendations as well. So what do you want that ongoing nurse to do? Or if your patient has deteriorated and come unwell, obviously your recommendations to the doctor is, you know, you want them to come and review them as soon as possible. Don't waste time rewriting information that you've already have. So if you've got all that information on your assessment, you know, social history, medication, past medical history, you just need to pick it up and read it, okay? And make sure you practice with the timer on. 8 minutes goes really quickly, as you can see from that example there. Again, I do private one-to-one OSCE tutoring for adult and child nurses. Also support if you are on second and third attempts. Also do mock OSCEs as well, online and in person. I do get really booked up. I'm fully booked now for January and getting quite booked up for February as well. I hope this has been useful, and I know there's been quite a few requests for it, so hope it's helpful for you that are self-studying.